Hi, everyone. My name is Ishtar Govia. I am a registered clinical psychologist in Jamaica, and I am trained as a research psychologist. My training is from the United States of America. I live and work between Jamaica and the UK currently, and I do work related to dementia care improvement, particularly dementia care improvement in and for low and middle income country contexts. And I'm very passionate about care and care equity, about treatment options, about training of the workforce, particularly as is relevant for low and middle income country contexts. And why is that? Because the current and projected burden of Alzheimer's disease is disproportionately in low and middle income country contexts. I appreciate that question because sometimes I get so passionate talking about the inequities and the need to channel more resources that I think it might create a biased picture. And so I really do appreciate the reminder to share about our successes as well. So we're wrapping up a project called STRIDE, Strengthening Responses to Dementia in Developing Countries. And that is UKRI funded, and it's led by the London School of Economics. And Jamaica is the only Caribbean country that is participating, even though we're wrapping up this project. And one of the things that we did across the 7 developing country contexts that participated was that we started with what we call a theory of change. So we brought together in each of the countries, and we did this in Jamaica, we brought together as many stakeholders as possible from different spheres. So policymakers, persons living with dementia, their carers, healthcare providers, non-governmental organizations, including faith-based organizations, law, business, insurance, etc. We brought together all of these stakeholders representing all of these different sectors to articulate at the end of a 4-year project period what would be a sign of success for you, that this project was actually worth it, it was worth the investment. And we've had successes that reflect those impact goals. So the overall impact goal is that persons with dementia live well and that their carers do not shoulder excessive costs or burden. And in Jamaica, we tweaked that further, and our stakeholders clarified that what they really wanted to see was a change in political will. What they also wanted to see was that research in this area was actually happening and that it was more visible. What they wanted was more active engagement of persons who are living with dementia and their carers. And we've been able to meet those targets. We've been able to meet them because we've taken a very, very active, passionate, engaged approach to the strategies that those stakeholders told us that they wanted, which is knowledge exchange. So not knowledge transfer, as in we, the researchers in our ivory tower, are telling you what to do, but really a bidirectional type and multidirectional type of engagement with stakeholders. And we did this through a lot of radio appearances, television appearances, active social media campaigns. And so this is one of the successes, is the rich knowledge exchange that we've seen, the way in which the dementia conversation has evolved in Jamaica and throughout the rest of the Caribbean region in the last 4 years. We've done a lot of social engagement, social media work and engagement activities. Throughout STRIDE, I think we've done over approximately 150 different events. Another major success that we've had has been our care management consultations. And these are free services, free of charge services that we provide to persons who are living with dementia and their carers. And this is a massive success because we realized that it was speaking to a need, a gap, where persons who are living with dementia or their carers just felt a sense of confusion. They were not clear. Often they were given a diagnosis or sometimes not even an explicit diagnosis, but a suggested diagnosis. It could be that you have something like this happening even without doing a clinical exam or any of the medical investigations. Sometimes persons leave their doctor's office with a sense of a suggested diagnosis. And they're clueless. They don't know what to do. The medical practitioners often are not able to connect them to resources. And so having these care management consultations and being able to help families think about, okay, I've just been given this diagnosis, or it could be that I may have this diagnosis. What now? And we found that so many of the families that we've been working with, they've been so grateful for this, the time, the attention, the ability to think in a much more complex way about what does this mean? What are some ways in which this thing called dementia may actually be presenting, that I'm assuming that my loved one who is living with dementia, or the person that I'm caring for with dementia, that she or he may be aware of, but really they're not able to control their behaviors. And so providing them with tools, providing them with information, providing with education, and learning about the diversity of ways in which dementia is presenting, that has been another major success for us.